Now, delivering medical care during a global pandemic requires teamwork, and that's at the highest level. And of course, you and I know that doctors are very fundamental to this effort. And as the world celebrates Doctors' Day, March 30th, thanking them for their extraordinary strength, courage, and dedication, of course, that's the theme, there is a need for us to recognize the heroic work of all frontline workers across the globe, but specifically here in Nigeria. The COVID-19 pandemic has further exposed the expertise and skills of medical practitioners and many more in the larger medical community who have worked to detect, treat, cure, and develop vaccines against this highly infectious disease to contain the spread, of course, COVID-19. Now, the frontliners have, over the last 1 year of the COVID-19 breakout, been on their toes to ensure protection of lives in Nigeria amidst sometimes shortage or even absence of personal protective equipment for their own safety. Now, they have also contributed tremendously to the success recorded so far in mitigating the spread of COVID-19, not just across the world, but also here in Nigeria. So, what then has been the motivating factor for our doctors, despite challenges faced, and how can the people, us, you and me, appreciate these categories of people who have put their lives at risk? Have you ever called your doctor or your nurse or any of those frontline workers just to say thank you? Well, today on the program, it's all about appreciating doctors, nurses, and as I said earlier on, all other frontline workers all over the world, but specifically here in Nigeria. How can we improve in showing genuine appreciation to all of them? Hello and welcome to the program. I am Claire Adelabu Abdul Razak, and it's Nigeria Today. As I said earlier on, it's Doctors' Day, and it's time for us to say thank you to all of them who, have put in their utmost best to ensure that we are here and we defeat COVID-19. So, joining me to discuss COVID-19, appreciating the frontliners on the program, I have the singular pleasure of welcoming Dr. Phillips Uchekbi, Secretary General of the Nigeria Medical Association, NMA, right here in the studio with me.
Thank you very much, madam. It's my pleasure to be here.
Should I say congratulations?
Thank you. Thank you. Yes.
Yeah. So, do you have a personal experience? I mean, by this time, 2020, we're almost in our first phase of lockdown. Yes, we're entering our first phase of lockdown. Share with us your experience, your personal experience.
Well, thank you very much. Not necessarily my personal experience, but being the Secretary General of the Nigerian Medical Association, being a medical director as of that time, being the chairman of the Nigerian Medical Association, FCT, as of that time, I was a key stakeholder in the policy making, in going around and making sure that our people are protected, in making sure that we cut down the complications, the sequelae, the mortalities that are associated with COVID-19. And it was a whole period of a lot of psychological stress because it was novel, it was strange. I mean, we were not used to it. It's not something that COVID-19 was something that curtailed your freedom, that threatened even the doctor, the healthcare workers at the front line, because it's not as if the disease or the infection is going to spare the frontline worker. And we were coming directly in contact with people who have COVID-19 compared to maybe all other persons who may not be in contact with people with COVID-19. You can imagine you're in the hospital and then maybe they bring in a patient that has all the symptoms of COVID-19, and then you have to deal with that patient. And despite your personal protective equipment, you find out that quite a whole number of us healthcare workers.
Did you come down with the virus at any point?
Well, it's difficult for me to say, but I'll tell you that quite a lot of us came down with the virus maybe before we even did the test, because sometimes quite a lot of them are quite mild symptoms, so by the time you could think about it, probably you're already getting better. As it is stated that largely most of them are asymptomatic, but some of us had some malaria-like symptoms and signs that, perhaps you would treat malaria first, and then before you know it, you do a test and they say it's COVID-19. I may have contacted it, but I didn't run a test.
You did have malaria symptoms?
Yes, I did.
What went on your mind? What did you do?
Of course, it was very scary because as of that time, being a strange illness, a strange infection, and you don't know who will come down with it. Although it was also a little bit of relief to say that when you are younger, maybe less than 50 or thereabout, and you don't have comorbidities like diabetes, hypertension, cardiac problems, that maybe it will not be so bad, So quite a lot of individuals, including frontline workers, healthcare workers, doctors, came down with COVID-19 even without knowing it, and it went unabated. But again, the personal experiences as, considering the individuals that we know, seeing the patients that came down with COVID-19 symptoms and watch them develop complication and see them die, it's not an easy task, and considering the fact that you don't even have a cure as of that moment or have a treatment of that of the disease makes it even worse, and considering the fact that we are endangered. But then, it's like a war front. It was like a warfare, where the military man, the soldier is in the war front and knows that he has to protect Nigeria, protect his people. So also this time around, the soldiers were the healthcare workers, the doctors were in the war front there, ready to confront it. I mean, if I don't do it, who's going to do it?
You talked about earlier on, you were sharing with me that you were among those in the emergency.
Yes, of course. Emergency operations center. Yes.
Just give us a scenario.
Well, in short, that was a whole lot of work, in the sense that there are different committees, that we are meeting on a daily basis from the Petroleum Task Force. From the Presidential Task Force down to the State Task Force and the FCT Task Force down to the EOC, which is Emergency Operations Centers. We were meeting virtually every day, 4 p.m. to analyze, what we saw on the field and to profile solution and to take statistics down, and to also, many of us were also going into the treatment centers to see what is going on, wearing our personal protective equipment and also getting people treated, making sure that government is, continue to be proactive, providing the personal protective equipment for the healthcare workers, particularly who were faced with it, and also giving very, very important advice. I remember at the early stage when I was in a meeting that has to do with the Minister of State for FCT. She had one other meeting again, and I mentioned that I think universal use of mask will be we work, and that we should put our hands on deck to start producing mask, cloth mask, any form of mask. But for that time there was really no proof to say that mask is
exactly, because so I was coming to.
Yes, people did not take it until research came out to show that masks have a lot of protection against COVID, and that is how it came up. So because it's something new, nobody can tell you that this is for sure, this is what it is. But a lot of things were tried. I'm sure you heard about even the different type of what I call it concoctions, maybe ginger, garlic. People were gargling all sort of things, taking hot water, some were inhaling.
Yes, I want to take you out of that, this area to look at another aspect, because we are appreciating the sacrifices that all you frontliners, from the doctors, nurses, and even the cleaners have put in to ensure that the rest of us stayed COVID-19 free. And I'm wondering that COVID came at a time when the MMA that you lead, was in constant state of, always embarking on strike for one reason, for maybe absence of, welfare. What was it that made you can't change your mind? You took on this job as if it was a renewed enemy.
Thank you very much. You know, if you've been in the ship before, the sea, there's what they call all hands on desk. This time around, this medical emergency that is killing people, even including your own persons.
Did the association talk to you? Did you have with?
No, there's a lot of meeting even within the association to understand that, look, this is not the time for any much negotiation, but rather this time to make sure that we play our part, you know, as the key stakeholders in healthcare sector in Nigeria. And so it's not about, and of course the government was also not ready to entertain strike. Rather, they were ready to meet up any demand, anything. You know, remember, even on their own, they pronounced some can I say allowances or encouragement, you know, or motivation to help doctors, because even some of them were coming down with COVID-19. So it was like a knee-jerk approach of saying, look, we have a problem at hand and we are in the best position to solve it. Now at this time around, we are the soldiers of the country and the Nigerians are having faith in us, and then we must do what is expected of us. And of course we have done that and we are doing it well, and we have continued to do it when it comes to COVID-19.
When a fellow doctor or a fellow front line health worker passes on, how what's the feeling, you know, amongst your colleagues?
It's quite a terrible feeling. It's scary and depressing, because you know, you realize that this person caught it in the line of duty. Yeah, it is, but again, that is not going to deter you. We signed for it. You understand?
Personal experience, anyone?
Yes, I have several persons that, quite a lot of them that I know personally, that we saw when they were sick and eventually died. But ethical reasons will not permit me to mention their name, but it's quite painful. And sometimes you wish that, you know, we had more solution as we're having now before that time, so that maybe these persons couldn't have died. Quite a lot of persons that died during the COVID-19, including medical doctors and healthcare workers, if there were no COVID-19, they would not have died. So it is very, very serious. It was painful. It was, psychologically tasking. There was a time sometimes we were thinking, this theory that the world will end, is it about to end? What is happening? Think about the lockdown. All of a sudden, this teeming part of the world has, went into silence everywhere, including Nigeria. You are moving in FCT. Only people you see are the task force who are making sure they ensure the lockdown, and then maybe allowing the healthcare workers, the medical doctors to pass because they are going on essential duty. But I will tell you, I must commend, the government too. The government of the day, the FCT minister. They were very, very proactive in this part. They all came together. We're having meetings, including police, military men, everybody, road safety, the minister himself going around. NMA, the NMA president, the chairman, every health worker. They were all contributing wherever they can, and information were shared promptly so that we see what we can do. And that is why you see that it wasn't it's bad, but at least better off than some other parts of the world.
It was quite interesting that even at that time, where the demand for medical practitioners, frontliners, was quite high outside the country, and of course it was quite attractive. We didn't hear of, for want of words, deviant, health workers who eloped or, traveled abroad just.
Well, if you look at it, it was a pandemic. People could not even travel as freely as they want to. But even at that, there is also this other issue where the infection was higher, probably in those attractive areas, vis-a-vis the United States of America, the Europes. You are living a place where the incidence is very low, to a place where the incidence is very high. That is exposing yourself to more risk. And then even the planes were not flying, remember very well. So it's not easy. It's time to think about saving your people. So people were not considering the issue of flying out for a disease that they don't even know much about. So yes, we stayed put here and made sure that Nigerians were taken care of.
One thing that the COVID-19 exposed, it has been described as a change agent, was the very fragile health system.
Yes.
When we come back from this break, I'd like for you to tell us what was your main major concern when you learned of the severity, of the pandemic, and of course the number of how quickly people were dying. When we come back, we'll take you on that. And it's been an interesting conversation, of course, with Dr. Phillips Uche Ekpe, who is the Secretary General of Nigeria Medical Association, NMA. It's their day, or it was their day yesterday, but we are celebrating them today. This is Nigeria Today. We'll be right back. Don't go away. Welcome back. If you've just joined us, you're watching Nigeria Today, and today on the program we are celebrating our own frontline health workers, appreciating them, of course, for the work they have done for us in checkmating COVID-19 pandemic. Just before we went on break, I had put a question to Dr. Phillips Ekpe on the weaker health, infrastructure.
Yes, exposure.
Yes. What was your main concern, as a doctor, as a gynecologist, when you, discovered that, wow, this was going to be overwhelming for us?
Yes, it was actually, like I mentioned, a situation that is new, that we didn't have a cure. The confidence of a doctor is the ability to proffer solution. I mean, people come to meet you that are sick, and you have nothing to offer. I mean, when I mean nothing to offer, you have no cure or solution. I mean, that was the first challenge, that if these patients come, what even do you have to give apart from symptomatic management? And then, of course, you saw the way people were dying so much in the Western world. I mean, Europe and America. And we also know that compared to facilities in those countries, compared to in our state here, that we have dearth of facilities, dearth of equipment. So what are we going to do if we have the same magnitude of a burden of disease? So it was a big problem. Remember at the beginning, there was this issue of ventilators. That, I mean, how many ventilators did we have in Nigeria as of that time compared to those places? And so you just realize that, look, even if we don't have ventilators, how is it going to come all of a sudden? You can see that people were donating ventilators. But again, if you notice, we have our healthcare workers, the ratio of doctors to patient is about 1 to 6,000 compared to UK where it is 1 to 300. So you can imagine that fear that, look, if people are coming down with the disease, how are we going to do it? Then we also now realize that we didn't have isolation centers. We didn't have, IDH, infectious disease hospitals in the country. I mean, these are things that were supposed to have been there so that they will handle this ab initio. We realized that we didn't have positions like what they call Surgeon General of the nation. We have it in the US and other countries. They are in charge of public health emergencies like this. They have to quickly draft in PTF, quickly draft in different coordinators, and these are people who are not totally experts, in these areas. So that was the fear.
One of our performance evaluation questions will be, how did you manage the situation?
Well, the good thing is that the whole world was at it, and Nigeria was not an exception. I mean, from the presidency down to the local government. You understand? And when there is a will, there will always be a way. I mean, we had all the will that we are ready to fight the disease. The government started providing. There was pressure on the government by the medical associations, by the citizens of the country. And government provided personal protective equipment, which was one of the first things that is very, very necessary, to make sure that the infection is curtailed.
Would you say it's rewarding, your efforts?
Well, very, very rewarding. I mean, we could have had more mortalities and more complication than what we are having now. But if you appreciate it more when you go to the treatment centers, and when you are a frontline worker, seeing what is exactly going on, you will now understand that this COVID-19 is not fake; it's real. People are really suffering, and you can see from the media, from different places, you see those who suffered COVID-19. They came out publicly to tell you how terrible it was. One of our colleagues, who had the renal shortness shut down, so adrenal shut down, was in coma for a long time, spent a whole lot of money treating himself. We will tell you the real truth of what they went through. Also, you remember that a media mongo of AIT who also came out openly and said, look, the thing is real, and the rest of them. So, but to see that as of this moment, the numbers are coming down, people are getting better, and there is solution apart from the different drugs that have been discovered to help. Of course, vaccines have been ruled out, and people are taking the vaccine. It's actually
I know you said you won't leave here without talking about the vaccine.
Yes.
Have you taken your jab?
I've taken my jab.
Okay, a lot of people are concerned about the effects. People are not talking about it. Share with us.
Well, first of all, is that I will tell you that anytime there is any change, people will resist it. Fear, skepticism, a lot of suspicion, lack of trust into the whole system, and some people, they sit down and concocting theories out of this fear that have no scientific basis or proof, and so it's expected, but we know that over time, and that is why you see that the president of different countries, the ministers, the FCT minister, the enemy president, and different persons came out to take it to let you know.
What symptoms, what effects did you have after the jab?
I will tell you, there were some lethargy. Lethargy means some level of tiredness. There were what they call myalgia, muscle pain, maybe around the area. Of course, that hand was a little bit weak for that, maybe 2 days. And I had what they call lymphadenitis of that particular area. That's the lymph node was swollen and it was painful. But I took some paracetamol and I got better. And I can tell you, I know 1,001 persons that have taken it, that have no such a deleterious side effect that I want to say they should discourage it. I think
there are videos circulating on the social media. Of course, you shouldn't believe everything you hear or read on the social media about using painkillers after taking the jab.
Well, I know there's a particular video that says that trending meat that they shouldn't take injection diclofenac. Well, it's welcome. That does not mean taking injection diclofenac does not mean we should now discourage a vaccine that is going to stop people from dying. I lost many persons that I know. How many more do I want to lose? No, I think those side effects can also be taken care of. They're not too bad. They talk about AstraZeneca and the clotting factor. And when we looked at, you compare 100,000.
And also the DNA factor, because right now a lot of people that say, look, they said it has come to change our DNAs.
Well, I'm talking to you. I'm waiting for my DNA to change. Some even said it has 66. Maybe they will go to people may go to hell or something. So I'm asking my pastor. I'm asking him. I say, okay. So I have no hope. Are you saying that? God can't even forgive me, really? If I've taken it, and I took it because I believe it. At this stage, and I think that it's just skepticism. To me, this vaccine discovery, this mRNA method is actually a new frontier to cure so many diseases. We are able to send a message through the messenger RNA to say, look, fight this disease. For instance, cancer. So I think it's something that we shouldn't discourage. I'm actually excited. Naturally, there is no time to test through the vaccine over 10 years. Vaccine is only, COVID is only just 2 years. Is it up to 2 years? It's even less than 2 years, 1 year.
This is our last question.
Yes, please.
Two in one. Do you feel that here in our country, that Nigerians have really appreciated you doctors and the healthline workers, and how do you think things can be done differently? How can you be appreciated differently? Very brief. We have less than 60 seconds.
I think during that period, a lot of healthcare workers, including doctors, were appreciated. But as it's getting better, they seem to have forgotten so soon. Remember we paid COVID-19 allowance that time, and now all of a sudden they've abandoned it. But yet we are still in the front line working. Our hazard allowance as doctors is just 5,000 naira. That is abysmal. If meanwhile I operate on patients with HIV, I operate on patients with hepatitis B. I'm endangered as a doctor.
Are doctors still going on their planned strike?
Yes, of course. I'm aware that they're going on the planned strike, which is supposed to commence tomorrow by 8 o'clock. And let me tell you the truth. Doctors don't. Let me say this. Doctors don't just go on strike. They will want to negotiate with the government, and government will be procrastinating and delaying.
Dr. Phillips.
Yes, statesman.
Yes, I'm
no,
sorry.
I need to say this, you know, so that we know. We should do it on
for
time.
you because my producer is saying I haven't clapped for you, so I have to clap for you,
Thank you very
and all
much.
the frontline workers.
Yes,
I
received the clap
Thank
and I
you.
extend it to my colleagues
All right,
for the great work
that's the much we
all the
can take
frontline
on
workers
the
are
program
doing.
today,
Yes, you know.
Nigeria Today. We
Yes.
really must appreciate, of course, our guest, Dr. Phillips Uche Ekpe, who is the Secretary General, Nigeria Medical Association, NMA, and of course to all the frontline workers across the globe, but right here in Nigeria. And to you, our viewer, I'd like to say thank you for your time, and always remember, Nigeria Today is live at 7:30, that's 7:30, in the evening every weekday, and you can also watch this and other editions of the program on www.youtube.com/NTA News 24 Hub. I am Claire Adedabo Abdul Razak for me and the production crew. Good night.